Good morning, everyone. Welcome back to our first Midwife Monday of the new year. I hope everyone has had a great beginning to the year and getting settled in. We are going to talk today about this crazy flu season. As many of you know, this is, I think on record, they're saying this is one of the worst flu seasons we've had in a while. So we get phone calls, emails, Facebook inquiries, everything about what do I do? I'm pregnant or I'm breastfeeding and I've gotten the flu. And it can be really disconcerting. And lots of, especially first-time mamas, second-time mamas, when they're pregnant with any kind of illness, you know, there's a lot of nerves that go around with that. Is it going to be okay for the baby? What can I take? Are those drugs offered through the doctor safe if I'm pregnant? So let's talk about some of that stuff. So let's just break down, first of all, what is going around. So here in the Los Angeles area, and I'm pretty sure certainly nationwide, the flu is prevalent currently. That is what a flu is, right? So it's a virus. And it's presenting with body aches, high fever, congestion. There's also this other thing that's going around. It's the barfing thing. So different than the flu, but that is something that's happening. It's an intestinal virus that's going around that is equally taking families out. And that is this vomiting thing, and it's basically you're barfing for, I don't know, every 30 minutes for 12 hours or something. And it's really, really significant, and it's really, really contagious. And it basically, you know, it starts with one person in the family, and then boom, 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 like dominoes. It's just taking everybody down. It's taking neighbors and friends, and everyone has this barfing thing. And likewise, everyone is getting the flu. So sometimes it's a 1-2 punch. And we've had pregnant women getting both. They'll get the flu or the stomach thing, and then they get a little bit better, and then the other thing hits home. So, so the number one thing is the CDC, the Center for Disease Control, recommends that all pregnant women get the flu vaccine. Highly controversial. Certainly a personal decision if you would opt to get that flu vaccine. I have heard, and I didn't pull up the statistics before doing this Facebook Live today, I didn't pull up the statistics on how effective that flu vaccine has been this year, but I feel like maybe 10%, yeah. I heard that the effects of the flu vaccine this year have been very low. I do not want to perpetuate rumor, but, you know, I did hear it wasn't very effective. So it's certainly a personal choice if you're choosing to get the flu vaccine. It might be too late. I'm not sure if they're out of them, right? Because a lot of places are out of the flu vaccine. They're out of Tamiflu. They're out of herbal remedies for this flu because it's so prevalent right now that people can't keep their stock up on some stuff like this. The ERs are just full with people with the flu. There's nothing that the ER can really do for you, the emergency room can really do for you, except maybe hydrate you. And that's about it. It's going to run its course. It's a virus. It's going to run its course. So first of all, let's talk about pregnancy. It affects, so it can affect you, right? Obviously, first trimester, second trimester, third trimester. And so we look at these things differently in each trimester. First, the first thing to do, if you have a high fever, and you are pregnant, we'd like you to take that fever down, right? It is important to keep your fever below 100.4 when you're pregnant. A sustained high fever, you know, can cause a baby's heart rate to go up. So we want to make sure that your body temperature doesn't stay elevated for a prolonged period of time. Think about how many pregnant women won't even take a hot bath, right? They're like, can I get in the bathtub? Of course you can get in the bathtub, but you can't get in into a jacuzzi. So we don't want to elevate your body temperature, right, in a jacuzzi, which is 102, 103, 104 degrees. Likewise, with a fever, we don't want you up at 102, 100, you know, that's a really high fever for an adult, 102. We want to keep that fever down. There are benefits to a fever in our normal life, right? For me, non-pregnant, it's appropriate for me to have a fever. I don't necessarily have to take my fever down. I want my body temperature to rise and kill the virus. But in pregnancy, we don't want you to have a sustained body temperature of anything above 100.4. Anything above 100.4 is technically a fever. Anything below 100.4 is not a fever. And we have women call and say, I know, but my body temperature, I usually run like 97.8. That's where I run. I have a low body temperature. So when my body temperature rises to about 99, I don't feel so good. I might have some body aches, but technically I do not have a fever, even though my normal baseline body temperature is low. So for pregnancy, Tylenol is appropriate to keep down your fever. We just don't want you to be walking around and with your body temperature up so hot, because it makes everything hot inside your belly, right, where your baby is. So Tylenol is appropriate to keep your fever down. Hydration in any trimester, right? Tylenol is safe in the pregnancy. In any trimester, we want to make sure that you are hydrating well. That's really important. So hydration. And it's hard in pregnancy and anytime actually when you have an illness. Sometimes you can't drink water. Every time you drink water, you throw up. So you want to do like a teaspoon. If you could just get a teaspoon of fluids in every 15 minutes, you're fine. Broths are really great. Making bone broth is really great. You can purchase bone broth, really great. And we're just talking about sipping, sipping, sipping. You don't need to be chugging. You don't need giant volumes. You just need enough to keep you from getting super dehydrated. In any of those trimesters, we're not that concerned about caloric intake, right? Oftentimes with the flu, you have no appetite. And so we say that's okay. Just hydrate and easy foods on your belly, right? We're not really concerned about you getting your dark greens. We're not interested necessarily in you drinking your green drinks and juicing, and you're just going to do whatever you can tolerate, whatever feels okay for your body, and with the main focus being on hydration. So if you do get the flu, hydrate, take Tylenol. The other thing you can do is any herbal remedies. So safe in any trimester of your pregnancy, elderberry syrup is safe. Any other like garlic, onions, like fire cider, that's that thing that if you watch our Instagram page, we were doing shots of fire cider. We are out, but Christine is our acupuncturist, and she makes a killer fire cider. I believe Karina Romero, who's another mom in our community up here in Santa Clarita, she also makes fire cider and elderberry syrup, and often we're stocked here. Hopefully we will be stocked by midweek here because Christine is back in town, so we're hoping to get our elderberry and our fire cider back in stock. But elderberry syrup is safe, fire cider is safe, Master Tonic is safe. Those are things like it has onions and garlic and cayenne and apple cider vinegar and things like that. You can also take a clove of garlic, chop it up, put it in a cup or in a jar, pour boiling water over it, add juice of 1 lemon and honey to taste, and you can drink that hot. You can keep that garlic in there if you have it in a big jar, and you can keep it in your fridge and let it just steep with the garlic for 24 hours, and you can drink it over that 24-hour period. You can strain the garlic out if you want. Garlic is antibacterial, antiviral, antifungal. It helps boost your immune system. So those things are really safe in pregnancy. Natural remedies are generally safe. Homeopathics are safe. So a lot of people call and ask if they can take that homeopathic. It's called oscillocin. It's that oxyli, that long word that nobody can pronounce, starts with an O. And apparently I think most places are out of it right now, but you can always try. Most pharmacies, Walgreens, CVS, Rite Aid, they carry it. It comes in a little blue tube. A couple of different companies make it. Byron is one popular one. It's spelled Biorion. Blue tube. Usually they have it near the register, or they have it in the cold and flu section in a pharmacy. And it's completely safe in any trimester of pregnancy. If you want to do that homeopathic medicine, you want to do it at the very, very, very first sign that you might be coming down with something. That's the first course of action you want to take, is take it per the instructions on the box. And echinacea is fine. First trimester, we generally say kind of stay away from echinacea. No astragalus when you are in your first or second trimester of pregnancy. So if you have an herbal immune support thing that comes like a combination, astragalus is something you want to stay away from. But you can do oil of oregano, you can do grapefruit seed extract, you can do garlic and onions and all those medicinal herbs. And super duper hydrate. Okay, that's the really, and go to bed. You've to just acquiesce and go to bed. Don't try to push through it. But your body just needs time to recover. So any trimester, all those things are safe. Those things are also safe in breastfeeding. While you're breastfeeding, you might want to avoid the garlic drink. You might want to avoid the fire cider. It depends on how your little one tolerates high doses of garlic and onion, right? So some babies can tolerate it fine with moms doing that while they're breastfeeding. Other babies, it just sends them through the roof, tons of gas, and so not really, it's just going to make things worse because you're going to do it and then the baby's going to be up all night crying. So I would certainly avoid fire cider, master tonic, or garlic lemonade. Certainly if you have a 6-week-old or younger. So speaking on the breastfeeding component, if you are breastfeeding and you have a brand new baby at home and your partner or one of your other children gets sick with the flu, remember, you make antibodies against your family members' viruses and bacteria, right? Your breast milk is a living food. So you will be making antibodies that will protect your newborn baby. So there's no need to really separate from your family member. So if your partner has the flu, don't sequester that person into another room. Obviously, they should cover their mouth if they're coughing. You don't want, everybody should be washing their hands frequently. Lots of vitamin C, lots of zinc. Okay, those are really important supplements that you can take, pregnant or breastfeeding. Vitamin C is water soluble. You're not going to take too much vitamin C. The worst thing you're going to do is take too much of it and it's going to give you loose stools. No big deal. If you're pregnant, you probably need some loose stools. So up to 3 grams, 3,000 milligrams of vitamin C daily in addition to whatever's in your prenatals is totally appropriate to be taking while you're breastfeeding, while you're pregnant, first, second, or third trimester. Extra vitamin C is totally safe. Zinc is also safe. So when you're breastfeeding, the people around you, if they're near you, you're going to make antibodies which are going to protect your newborn. Likewise, if you, as the breastfeeding mother, get sick, you're still making those antibodies in your milk, so you don't need to stop breastfeeding. Breastfeeding is very, very, very important. Do not discontinue breastfeeding. If you have a specific concern about some kind of illness and you are breastfeeding, please call the office or talk to a lactation consultant, an IBCLC. I'm an IBCLC. I'm happy to answer your questions about breastfeeding and illness. So do not stop breastfeeding if you have the flu. Also, do not stop breastfeeding if you got that vomiting thing, right? Keep breastfeeding. If your baby gets the vomiting thing, at least you're breastfeeding, right? You're keeping this baby hydrated. So there's no reason to stop breastfeeding. Let's talk about Tamiflu. Tamiflu is a medicine that is given to you at the beginning of flu-like symptoms. It is a medicine that shortens the duration of the flu. In pregnancy, it's a category C. So what that means is we don't really know how safe it is in pregnancy. So unless you have other compromising factors where you are prone to pneumonia, you have asthma, and you are prone to severe asthma attacks, there are some secondary complications from the flu that you want to talk to your healthcare provider to see if it would be appropriate for you to take Tamiflu. But in general, it is a category C. So it is, if the benefit of Tamiflu outweighs the risk of the flu, it's something that you might consider taking. Otherwise, we say stay away from the Tamiflu when you are pregnant. Tamiflu in pregnancy, if you choose to go that route, is safe according to the CDC. Oh, what did I say? Breastfeeding. Tamiflu is considered safe in breastfeeding. Very small amounts of that drug actually get into your breast milk. So the studies show that when you look at the breast milk and you study it for that particular chemical that is Tamiflu, I don't know what that's called, I forget, but whatever that particular drug is, if the molecule is just too large, it doesn't get into the breast milk. So it is safe to take Tamiflu when you are breastfeeding. Not everybody wants to take Tamiflu. It's a personal decision if you want to take Tamiflu. I would, if you're otherwise healthy, you don't have a a risk factor for pneumonia. You don't have severe asthma, right? Breathing is really important. So if you can't breathe, you need to do whatever it is that your healthcare provider tells you to do in order for you to breathe properly, obviously. So if Tamiflu is the direction that's recommended for you while you're breastfeeding, go ahead and do that. Listen to your healthcare provider. We know it's safe. Many of our clients here at the birth center don't take Tamiflu, and that's totally good. I mean, don't take it. If you don't need it, don't take it. Just kind of, like I said, acquiesce and just deal with it. It's going to run its course, about 7 days, 7-10 days. And then there's going to be residual coughing, fatigue, mucus, all of that stuff, but your fever will be gone by that point. And then you just have the dregs of dealing with the aftermath of having the flu. It is, the CDC says it is safe to do a flu vaccine in your pregnancy. I'm not a big supporter of the flu vaccine in your first trimester. I'm not particularly a big supporter of the flu vaccine in general, because I believe that in our demographic here at the Santa Clarita Birth Center, we have very healthy mothers. So speaking from my personal demographic, our moms don't need the flu vaccine because they won't wind up in the hospital with secondary complications due to the flu. But you have to always assess each person. I don't know who's listening to this. I don't know what your history is, but you always want to talk to your care provider about whether or not that flu vaccine is appropriate for you in your pregnancy. And flu vaccine, the CDC says it's safe in breastfeeding. So that's a choice that you can make on your own. So recap some of the things. So it's common. It's happening all over the place. Make sure you're washing your hands. Ways to prevent the flu. Hand washing. Don't go to anybody's house that has the flu. Maybe avoid large crowds. Maybe, boost your immune system before you get the flu. So what I personally do every day is we sell this berry juice here. It's a combination of these super high antioxidant berries. It's $40. I do a teaspoon of that every day. And I also do green spectrum, which is this spirulina, chlorella, alfalfa, these like super high nutrient, micronutrient greens. So every day I do that. I also do fermented cod liver oil every day. I put that in my coffee. And most people think that's really gross, but it's not. I do the cinnamon tingle. I do a scoop of it in my coffee, and I froth it with this little frother, and I drink down my coffee, and I think it tastes just fine. So lots of hydration, lots of sunshine, lots of rest. Decrease your sugar, decrease your processed foods. Make sure you're eating high quality foods. Increase your vitamin C. Do extra zinc. You can do elderberry syrup. You can do Master Tonic. You can do fire cider. Increase your garlic daily. Raw garlic is really, really super good for you before you get sick. So those are some things that we recommend to prevent the flu. And if you happen to get the flu, you're going to watch your fever. Make sure you keep your temperature. If you are pregnant in first, second, or third trimester, keep your temperature below 100.4. All those other herbs that we talked about are safe in pregnancy, and they are safe in breastfeeding. Fever isn't as much of a concern when you are breastfeeding. You may notice in breastfeeding, if you have a high fever, that your supply might go down a little bit. Do not be concerned. It will come right back up again as soon as you're feeling better and hydrating better. So then this barfing thing. So yeah, that's a drag, okay? Same sort of principles apply. We are seeing that it starts, it will go through the family, like every 24 hours somebody will get it. So lots of hand washing, lots of immune supporting herbs to keep you from getting sick. Once you get it, don't worry about eating, just eat whatever you can tolerate. Hydration is critical. And the big concern in pregnancy, especially third trimester, dehydration can cause preterm labor, right? So we want it second and third trimester. So we want to make sure you're just hydrating. That's what your focus is going to be on in your pregnancy with either the stomach virus or the flu, is just really focus on your hydration. So little sips. You can make smoothies. You can make protein shakes. You can drink, you can eat soups, herbal teas. Those are all things to help keep you hydrated. Okay? So hopefully that will help during the season. We're getting lots of calls, like I said, so feel free to email us, contact us on Facebook, follow us on Instagram, and I think that's all I have to say. So if you have any questions, contact us at the SCV Birth Center. The link is in the profile. And thanks for joining us, you guys. Have a great rest of your week. Bye.